Step into this primary care clinic in Yorkville and you won't find a crowded waiting room. It advertises short wait times, unrushed appointments, as well as on-site lab testing and easy prescription refills.
I came in, I registered, and they saw me within like 10 to 15 minutes. Gave me a pretty comprehensive workup in the sense that they were asking me a bunch of questions.
It's staffed by nurse practitioners who can diagnose common ailments, prescribe medication, and refer patients to specialists, just like family doctors.
Our kind of mission statement was, how can we basically design and develop our dream family practice?
But an appointment at that dream practice comes at a price for patients, $75 for a single appointment and hundreds of dollars for an annual membership.
Kind of sucks that I have to pay for accessibility.
CEO Alon Burstein says it's legal to charge patients since nurse practitioners can't bill OHIP like physicians do.
I mean, I know this is a very touchy subject, especially in for us Canadians. But really, the fact is that most Canadians aren't aware that we've had a so-called two-tier system for many years already. This isn't really something new.
Clinics like this may not be brand new, but they do appear to be growing in number. The Nurse Practitioners Association of Ontario says it's noticed more private clinics opening up in the last couple years and is aware of about 24 throughout the province. A sign, the association says, that nurse practitioners should be allowed to bill the province for services.
There's insufficiency of easily accessible funding mechanisms right now.
And a consequence of an overall family doctor shortage. Until last month, Rizwan Sheikh operated a clinic in downtown Toronto.
We have been recruiting for physicians for a very long time. We were successful with 2 physicians, and retaining them past the 6-month period was extremely hard.
In the fall, he made a switch from a clinic staffed with doctors to one with nurse practitioners and started billing patients for visits. Sheikh closed his downtown clinic early this year and is now working on plans to open a new clinic in Pickering. So what exactly are the rules governing these private clinics? Now, owners point out they can't bill OHIP, and nurse practitioners are not directly mentioned in provincial legislation related to OHIP. But critics say charging patients for primary care still goes against that legislation and the Canada Health Act, which guarantees universal access. We reached out to Health Canada, and in a statement, a spokesperson told CBC the federal government is concerned that the increased scope of practice for nurse practitioners has resulted in patients being charged for services that would be covered under provincial health insurance plans if provided by a physician. The Ontario government does fund some nurse practitioner-led clinics, but only 25 in total. We asked the provincial health minister about all the other pay-out-of-pocket clinics that have opened.
OHIP-funded services cannot and must not be charged to a patient. So first of all, that is a hard stop.
But with so many private clinics popping up, the executive director of the Ontario Health Coalition says the province isn't taking the issue seriously enough and could easily clarify what's allowed under the law.
And if there's any ambiguity in Ontario law at all, and we don't accept that there is, I think it's pretty clear, then the government could have moved months ago to clear that up. They could have, it's just a question of regulation.
In October, Jones said the ministry would investigate a private clinic set to open in Ottawa that caused public uproar. Months later, the clinic is open and continues to advertise private primary care through nurse practitioners. Sarah McMillan, CBC News, Toronto.